The E. Donnall Thomas Lecture reviewed past, present, and ongoing efforts to enhance acute and chronic GVHD outcomes. I'm joined now by the recipient of that lecture, Dr. Bruce Blazar. What can you tell us about those enhanced outcomes that you have done research on?
Well, it was really inspired by being on the ward and seeing patients who needed additional therapies, and we were fortunate enough to have models that we could do to look at proof of concept, and then if those were positive, then many of the companies that we were working with or our own bone marrow transplant program were able to translate that into the clinic, several of which went for FDA approval.
Yes, tell us a little bit more about the drugs that have been approved by the FDA. As of now, there are 4, and what can we expect in the future?
Ben Watkins and Leslie Keane did the abatacept trials, and those were FDA approved for acute graft-versus-Host disease prevention. That's the only approved drug. And then there were 3 in chronic graft-versus-Host disease. One is this ibrutinib, another one is belumosudil, which is a ROCK2 inhibitor, and the last one was ruxolitinib, which was really pioneered by Robert Seisser as a JAK1 and JAK2 inhibitor. And those are approved. Ongoing studies, recent publication of a blocking anti-CSF1 receptor antibody, which looks very positive, and several of the other ones that we brought to clinic are going very well. The bortezomib, which was done by Bill Murphy, has already been used in treating chronic graft-versus-Host disease. So both ones that had existed, but for FDA approval, these came from, in part from the mouse models.
And what do you hope that all of the hematologists who attended your lecture will really take away from your presentation and what you shared about being able to continue looking at both the acute and chronic treatment of GVHD?
Yeah, I think the most important thing is there should be hope. You know, when we started this, there was nothing. And then the field itself has added to the armamentarium of available therapies so that patients no longer have to be left with, we don't have anything that can treat you. We can use these approaches, but we don't know if they're going to work. Now we know that some of them will work to enough of an extent that the FDA has approved them.
Thank you so much for your time, Dr. Blazar.